Mr. Shimkus.
Thank you, Mr. Chairman. You know, the country knows that no one read the stimulus bill, and they're going to hold us accountable. Here's the tri-committee draft, which I was intending to read, but I knew that it would be superseded by the bill. And I was about ready to read the bill, but I knew that it would be by the manager's amendment. And we can go through this, Mark, but you know what? I know when we get to the floor that there'll be a manager's amendment that'll have 300 different pages that no one else will read. And that's the process that we have fallen into in this Congress. The brightest, the best, the smartest, most important committee in the House of Representatives, and we have resolved to bullying, intimidation, no transparency, and we ought to be ashamed of ourselves. The fundamental question before us is, will our constituents and our nation be better off in 10 years if we enact this bill, or will they be better off if we do nothing? Today we have the opportunity to make a difference in the lives of our constituents. From today, when a constituent comes to us and says, I've lost my private health insurance, we will have an answer. When people lose their jobs because we have passed an additional cost of doing business on business, and they say, why have I lost my job? We will have an answer. When a constituent tells us, I can't personally pay for health care anymore in this country, we will have an answer. When a small business tells us the rates for their employees went up, so they dumped all their employees into a public plan, we will have an answer. When our providers tell us that the public plan is no longer funding adequately the cost of care, we will have an answer. When people ask us, how can the greatest, richest country in the world ration health care and limit access to the most modern care and drugs, we will have an answer. When people ask us, why do we need a lottery system for a doctor's appointment, we will have an answer. When seniors say, why won't you tell us there's a drug that can save our life, we will have an answer. And when we ask ourselves, why would we accept a Canadian, a British, a New Zealand, Australian example of health care which rations care and limits choice, we will have an answer. I yield back my time.
Thank you, Mr. Shimkus.